As the name suggests, retinal detachment is a condition that occurs when the retina, a light-sensitive layer of tissue at the back of the eye, is detached from the choroid coat layer of the eye. What signs or symptoms indicate a detached retina? There can be no symptoms if your retina has only partially detached. However, if more of your retina is detached, you might not see as clearly as usual and you might experience additional unexpected symptoms, such as many fresh floaters, small dark spots or squiggly lines that float across your vision. Either one or both eyes experience light flashes. Your field of vision contains a dark shadow or curtain on either side or in the center. A retinal detachment is usually a medical emergency. It's crucial to visit your eye doctor or the emergency hospital as soon as possible if you have signs of a detached retina. Retinal detachment symptoms frequently appear suddenly. If the retinal detachment is left untreated, more of the retina could separate, increasing the risk of blindness or irreversible vision loss. Are you at risk of retinal detachment? Although anyone can have a retinal detachment, some people are more vulnerable. You are more vulnerable if you or a family member has previously experienced a retinal detachment. You've suffered severe eye damage. You've undergone eye surgery, possibly to remove cataracts. You may also be more vulnerable due to other eye issues, such as diabetic retinal disease, a condition in people with diabetes that affects blood vessels in the retina, myopia, extreme nearsightedness, particularly a severe variety known as degenerative myopia posterior vitreous detachment, when the gel-like fluid in the center of the eye pulls away from the retina, various other eye conditions, such as lattice degeneration or retinoschisis, when the retina divides into two layers, thinning of the retina. Speak with your eye doctor if you are worried about your risk for retinal detachment. What are the causes of retina detachment? Retinal detachment can have a variety of causes, but the two that are most frequently cited are aging and ocular trauma. Rhegmatogenous, tractional, and exudative retinal detachments are the three different forms. Each variety develops as a result of a unique issue that pushes your retina away from the rear of your eye. How may retinal detachment be avoided? Since age is a common factor in retinal detachment, prevention is frequently not an option. But by using safety goggles or other protective eye gear when engaging in risky activities, such as playing sports, you can reduce your risk of developing retinal detachment from an eye injury. If you see any retinal detachment symptoms, visit your eye doctor or the emergency department as soon as possible. Early intervention can aid in preventing irreversible vision loss. Regularly getting thorough dilated eye exams is also crucial. Before it begins to impair your vision, a minor retinal tear or detachment can be found by your eye doctor with the aid of a dilated eye exam. Anyone can develop retinal detachment. It's crucial to visit an eye doctor to have any eye injuries or trauma, such as something hitting your eye. Check for early signs of retinal detachment. It's common to experience a few floaters, little dark spots or squiggly lines, in your field of vision, but if you notice a rapid increase in the number of floaters, it's crucial to have your eyes examined immediately once. How will my eye doctor examine for a detached retina? Your eye doctor can do a dilated eye exam to evaluate your eyes if you see any early indicators of a retinal detachment. After administering eye drops to dilate your pupil, your doctor will examine the retina at the back of your eye. Typically, this checkup is painless. To check for retinal tears, the ophthalmologist could press on your eyelids, which some patients may find irritating. After a dilated eye examination, if your eye doctor still feels that more information is necessary, you can be given an ultrasonography or an optical coherence tomography (OCT) scan of your eye. These two painless examinations can assist your eye doctor in determining the precise location of your retina. How is a retinal detachment treated? Your eye doctor may advise laser surgery, freezing treatment, or other types of surgery to fix any tears or breaks in your retina and reattach your retina to the back of your eye, depending on how much of your retina is detached and what type of retinal detachment you have. Your ophthalmologist may occasionally combine several of these techniques: cryopexy, freeze therapy, or laser surgery. Your doctor can use a freezing probe or a medical laser to seal any tears or breaks in your retina if you have a small hole or tear in it. These procedures are typically available in an eye doctor's office. Find out more about freezing therapy and laser surgery. You could require surgery to put your retina back in place if a significant portion of it has come loose from the back of your eye. These operations might have to be performed in a hospital. Find out more about the procedures performed to fix a detached retina. Treatment for retinal detachment is effective, particularly if the condition is identified early. If your retina detaches again, you could require a second treatment or surgery, but for roughly 9 out of 10 people, treatment is ultimately effective. If you have found this video useful, please subscribe and like the video. Thank you.